everyone, welcome to Easy Nurse, where nursing education made easy. Let's continue with this session, that is Unit 14, First Aid. In last class, we have discussed about first aid management for emergency conditions, right? And musculoskeletal injuries. Under musculoskeletal injuries, we have discussed about the fractures, right? So today we will discuss about dislocations under musculoskeletal injuries. Let's move on to the topic, that is dislocation. What does mean by dislocation? Dislocation is defined as distractions of tissues around the joints and displacement of bones. Most common joints that can dislocate are shoulder, knee joint, and fingers joint, or jaw or thumb. Okay, so you can see the pictures. The picture that person is suddenly fall down and they got elbow dislocation. Dislocation means the joint has dislocated from the place. So that is called dislocation. Then what are the causes of dislocation? Sudden twisting, sudden fall down, car accidents, or maybe any sports, any indoor or outdoor, not indoor, outdoor sports. Okay, and muscle weakness. When you have a muscle weakness, suddenly you maybe fall down and there is a dislocation of the joints maybe happen. Okay, so dislocation is nothing but the bones or joints may be dislocated from the displacements may be happen. Okay, so the common joints are the shoulders, knees, or thumb or fingers. Okay, so causes sudden twisting, fall down, car accident, any accidents. Okay, that is called, those are the causes of dislocation. Next is signs and symptoms. What are the symptoms? Suddenly you fall down and the bones, the joints has dislocated from the part. Then what will happen? There swelling will be there, pain will be there. Then you are unable to move the joints. Then blushing, the bluish discoloration will be there. Okay, those are the signs and symptoms of dislocation. If any dislocation is happen in the joints, then how you will give the first aid management. Okay, so first is ensure. First, ensure the victim stays calm. Mean you have to give the psychological support to the victim so that they will not get panic. Okay. Next is help victim to hold up the dislocated joint in a comfortable position. So if the person is fall down in the floor, so you have to hold that fractured part and you have to give a comfortable positions. Okay. Then you have to use the bandages so that they immobilize the dislocated joint. The joint will be not mobilized, so that the joint will be the displacement will not happen. Okay. Next is in case of arm displacement. What will happen? You can use the splint. You can see in the picture the splint. They are using that splint so that the that arm which is already displaced, it will not move. It will not mobilize. Okay, so it will immobilize the part of the dislocated area. Okay. In case of leg injuries, if you have any leg injuries, then what you can do, like both fold bandage. Both fold bandage means what? You can see in the picture. You have to keep both the legs together, and in between, in that middle, you have to keep some cloths. Okay, which we can say padding. So you can see here they are using padding in the middle part. Then with the bandage, they are tying that both the legs so that that area will be not mobilized. Okay, then there is no chances of getting dislocations. Okay, so if you have any leg injuries, they are doing the broad fold fractures bandages they are using. Both fold bandages they are using. If you have any arm dislocation, then they are using the splint. This is splint. That is broad fold bandage. Okay. The next is if any swelling will be there or pain will be there, you can use the ice pack. Okay, but ice pack you should not use directly on the skin. Okay, because it will be sensitive. So you have to wipe with the cloth and then you can apply. Okay. Then at last, you have to transport the patient or transfer the patient to the hospital. Okay, you have to take the victim to the ambulance and you have to transfer the patient to the hospital so that they can get the further treatment. First, you have to give the reassurance to the patient. After giving reassurance, you have to immobilize the part. Okay, so that it will not get deteriorated. Okay, so you have to immobilize the part. Then you have to give some ice pack. If swelling or pain will be there, then you can ship the patient to the hospital. Okay, so that they can get further treatment. I hope you all understand about the dislocation and how to manage the dislocations. Okay, so let's move on to the next topic. That is muscle injuries. Okay, it is come under the musculoskeletal injuries. First one is fracture, then dislocation, then muscle injuries. So muscle injuries means what? So muscle injuries occur due to the severe stretching or of muscles. Okay, stretching of muscle because of sudden exertion and twisting of any part of the body or any part of the body, that is called muscle injuries. If you are doing the excessive stretching of the muscle, then what will happen? You will get the pain over the muscle, then swelling will be there. Okay, so when you are doing the excessive exercise also, sometimes it may happen, the muscle injuries may happen. Okay, so what are the causes? Because of doing the too much of physical exertion, then improper warming by prior to the physical activity. Okay, less flexibility in the body. Then signs and symptoms. Okay, so what are the signs and symptoms? If any fracture or any dislocation or muscle injury will be there, means that the common signs and symptom, that is swelling will be there, pain will be there, then severe pain, swelling, difficulty to move the joint. They can't able to move the joint because there is a dislocation or fracture, or maybe muscle injuries is happen to the muscles, so they can't able to move. If they are moving, means what will happen? They will get the severe pain. Okay, so then discoloration means the color, the skin color will be changed, like bluish color will be there. Okay, then bruishes of the skin, means bluish discoloration of the skin may be happen. So those are the signs and symptoms under the muscle injuries. When you are getting the muscle injuries, those are the signs and symptoms you can observe. Okay, so next move on to the management. How you will give the first aid for the muscle injuries. Okay, so first you have to give the provide comfortable position and reassurance to the victim. If you are not giving psychological support to the victim, what will happen? They will get panic. Okay, so firstly you have to reassurance, or you have to give the psychological support to the victim so that they can feel calm, they will calm, then they can, whatever instruction you are giving, they will follow that. Okay, then you have to, after that you have to give the proper positioning. Okay, you have to give proper position, then you have to start with your first aid management. Okay, if possible, put firm bandages before swelling occurs. Okay, you can apply the bandage over the area so that before it got swell, it will be reduced, the swelling will be reduced. Okay, after application of bandage, you have to wet it with the cold water. Okay, or you either then you can use ice pack. Okay, ice pack also you can use, so that if any swelling or pain will be there, it will reduce. Okay, then take the patient to the doctor. And ultimately you have to take, that is a first aid management you are giving for on the spot. Okay, so to minimize the pain or minimize the swelling, but you have to consulted from the doctor also. So for that you have to shift the patient or transfer the patient to the hospital for the further management. Okay, so I hope you understood about the musculoskeletal injuries under the fracture. If fractures happen, means how you will manage the fracture patient, or any dislocation happen, means how you will manage or how you will give the first aid by yourself on the spot. Okay, then muscle injuries. So when muscle injuries happen, means how you will give the first aid management. Okay, and with this we have come to the end of this session. In next session we will discuss the further topic. Till then, keep learning and keep exploring with listeners. Thank you.